I really believe that everybody needs to individualize their diet. So, vegan may work for someone, keto may work for another person, but it's finding what works for your body, your gut health, and your energy.
What role does mindset play in achieving health and wellness goals?
It's going to be hard. It's hard for everybody to make a change. So, being brave enough to take that first step is a really big deal. Don't sort of, underestimate that or sort of push it down.
They know everything, but they're not doing it. What can they do to get over that little hump where the action starts? My guest today is a former elite level dancer who gravitated to a career in health due to her love of movement and wanting to get a better understanding of nutrition to improve overall health and performance. She has extensive training and qualifications in Pilates and other movement modalities, including the Gyrotonic expansion system and classical ballet. A qualified nutritionist and food scientist, Kate has worked within the health and nutrition field for more than 20 years, and her passion is to help people move well, eliminate pain, live a balanced life, and make being healthy easy. Thank you for being here, Kate.
Thanks so much for having me on the show. I'm really looking forward to chatting today.
Me too. I am interested in everything that I just listed off there. But my first question is, what's the first step to making being healthy easy?
I think the first step is really just deciding to make the change. But when we make that decision, we have to really want it. So for so many of us, it's, something tends to have to happen. Maybe, let's hope it doesn't happen, but, maybe it's a diagnosis from a doctor. Maybe we've gotten on the scale and we, have just gone, oh, I just didn't realize I've put weight on, or maybe you're just really not feeling confident in yourself. So there just has to be something deep inside you that goes, I'm ready to make this change, and why you really want to make this change. And I think once you find that, that's the first step to just think about and then go from there.
On a personal note, I would love to hear about where you are at the moment with your own health and what have you overcome to get where you are.
So at the minute, I'm in a really good position with my health, whereas where I sort of feel that I've got a good balance between cardio and weight work, and nutrition wise, I really believe in balance, that sort of 80-20 rule. But it's taken me years to get to this point. Back, in my teenage years, being a dancer, I had an eating disorder, really restrictive eating, trying to keep my weight down. And as a result of that, I was tired all the time. I wasn't menstruating, all of these things that kind of go hand in hand. And then that sort of led into, went to university and did my nutrition course and learned what I should be eating. It still took a while for me to start to change my diet, just from that sort of mental health side, trying to address that. And then going through and having kids, your health goes up and down. You don't have as much time to work out and focus on things because you're bringing kids up. So having gone through all that with my girls, 8 and 10 now, I feel that I'm in a really good position to find that balance and have a little bit more time to focus on the things that I need to do for myself.
Yes, I would love to dive into nutrition. I feel like it's a very confusing and complicated subject for most because of all of the contradictory information out there. So, where do you stand when it comes to diet and nutrition?
I really believe that everybody needs to individualize their diet. So, vegan may work for someone, keto may work for another person, but it's finding what works for your body, your gut health, and your energy. So, depending on whether or not you have, a health condition, maybe it's diabetes, maybe it's an autoimmune condition. So working with that and paying attention to how you feel after you have food, I think is really important too. So there's always some basics, everybody can eat fruits and vegetables and get lots of benefits, make sure we're drinking plenty of water. But when it comes to whether or not, what protein you're eating, at what time of day you're eating, whether or not you're intermittent fasting, I really believe that needs to be individualized. What your friend does may not work for you because your body and genetic makeup is very different to them.
Okay, so it sounds like you customize plans as far as the individual.
Yeah. So generally when I'm working with somebody, say a woman comes in and she wants to lose weight, I will look at, her age, whether or not she's going through perimenopause and menopause, what health history she has, where she grew up, was she exposed to mold, what's her stress levels like, a full sort of blood panel so we can see what the minerals, her iron levels. So looking at all of that stuff together, we can then work out what program works for that person. I mean, it's really hard if you're just, sort of scrolling on Instagram or Facebook trying to work out what diet, is vegan going to work for me? Is keto going to work for me? I think to try them and sort of find out what works for you.
Yes, I could not agree more. I mean, from my own experience, I jumped around the different diets. So it may even be that vegan works for you now, or carnivore works for you now, or keto does. And then in 6 months or 5 years, you find that your body needs something else.
Exactly. And that will be, maybe you're going through, your hormones are changing. Maybe you're going through a stressful situation. Maybe your gut health is changed. So many things change over the years. So things that worked for you in your 20s and 30s might not work for you when you hit your 40s and 50s. So I think the more we can become aware of listening to our bodies and the signals that it gives, the better and easier it is to make adaptive changes.
Definitely. I know that you help people eliminate pain, and many people are struggling with pain today, discomfort of all kinds in their daily lives. How can holistic movement practices like Pilates help alleviate these issues?
Well, first of all, we start to build an awareness, of people connecting to their bodies. So like we were saying with food and how we feel after food, we start to get people to connect to their breath. So even just starting to connect to your breath and slowing down your breathing allows you to drop back into that parasympathetic state, that rest or digest state, which allows us to digest our food better. We can make better decisions. We have better focus, so better for our mental health as well. So building that body awareness and our proprioception, so just how we move in space, is a fantastic way. We start to learn that, when we bend over to pick up, that thing on the floor that usually gives us back pain, if we start to bend our knees and watch where our, knee position is and that sort of thing, we then are doing a better movement and causing less pain. So one of the ways is connecting to our breath. The second way is becoming aware of our movement. And then the third way is really starting to build strength and mobility and balance the two. So some people have pain because they're very tight and their movement is restricted. And then some people have pain because they've got the movement, but they don't have any strength to control it. So again, it's working out on which side that may be and then focusing on the strength or the mobility work.
The way that they move is also going to be dependent on the individual and where their pain is, and also where they are with their health in general. And everything sounds like it'll be bio-individual according to their history and where they are now.
Exactly. And it's not to say that you can't go off and do a general gym class where there's 20 people and not get benefit. You definitely will get benefit because you're moving your body and you may be elevating your heart rate and helping, your heart health. But if you have a specific injury or you have a specific pain in an area, say you've got knee pain and your friend has knee pain, they may have knee pain because their foot's rolling in. You may have knee pain because your hip stabilizers aren't strong enough. And so that's then affecting the knee. So again, general pain is not the same for everybody, like we were sort of saying with diet. So if you can see someone and work with someone to diagnose what the problem is and then do strengthening exercises or whatever it may be, you're going to get a quicker result.
Is there one tool or specific movement that those that are listening could just stop right now what they're doing and implement, whether it's contorting their body in a certain way or stretching in a certain manner, that could help 99% of the people? I know it depends on the individual, but is there one thing specifically that you see that helps most people that you work with?
I think just building an awareness through your connection to your core. So when we talk about our core, we're talking about our pelvic floor muscles, our 4 sets of abdominal muscles, our hip flexors, our diaphragm, which is related to our breathing, and muscles in our back called our multifidus, which help to stabilize our lower back, especially when we're sort of bending forward and getting up. So learning to connect to the core, I think, is one of those things that everybody should be doing, because it's going to benefit you whether or not you're trying to work out in the gym or you're just trying to get through everyday life and, bend over and empty the dishwasher and those sorts of things. So what everybody can do is, if you can sit down somewhere and just slide your hands in underneath your bottom, you'll feel 2 bony landmarks, and they're called your sits bones. And what I want people to do is try to visualize those 2 sit bones drawing together. And when you visualize that, you should feel a connection through your pelvic floor muscles. So your pelvic floor holds the urine in your bladder, okay? Helps you to not pass wind if you are not wanting to pass wind. So really important muscles for our continence, and it forms the floor of our core. So like a building, the foundations of a building need to be really strong, and that's the same with our core. With the pelvic floor being the floor, we really want to make sure that we have a really good awareness of how those muscles switch on, like we did with those sit bones drawing together and feeling that contraction, and then also being able to just gently relax them as well. So starting there and just practicing that connection of engaging the pelvic floor and gently releasing is sort of the first step of connecting to your core.
Okay, great. Is this also known as Kegels?
It can be, yes. So for women, sort of, either they've got, a weak pelvic floor, or maybe they've had a baby and they start to learn to contract their pelvic floor. It is known as Kegels, but men can do it too. So it's not just women, men can do it too. And, by engaging that pelvic floor, you are going to be strengthening your pelvic floor, or you can learn to release it. So if your pelvic floor is a little bit too strong and you've got issues with actually releasing your pelvic floor to be able to go to the toilet, then you can practice that gentle engagement and then focus more on the release. So something, as we age, our pelvic floor definitely changes. So definitely something to just be aware of. And we know that if we can get that pelvic floor engagement, we're going to get a stronger connection to our core. So if you're lifting, heavy weights and things, then you're going to be protecting those internal organs by engaging that pelvic floor so that they can stay nice and safe inside your body.
Okay, great. This is very useful, because this is what's going to help us prevent from getting into adult diapers and things.
Yeah, and prolapse. No one wants a prolapse. No one wants adult diapers. And all those ads on TV that tell you that it's totally normal to have to put a liner into your underwear, it's not totally normal. We can help ourselves not get to that point. So, if you are there, that's okay. Go off, visit a pelvic floor physio and get assessed and get some exercises, and you'll be surprised with how quickly you can actually turn it around.
Now, let's tie mindset into this. What role does mindset play in achieving health and wellness goals? And how do you approach this aspect in your work?
So mindset, is a big part of it, because if you are not in the sort of the right frame of mind, maybe you're, have a lot of anxiety or depression, or maybe sort of even low body confidence, then that's going to affect your sort of motivation to get out and, make a change, do a class, eat healthy, whatever, aspect of health you're starting with. So that's why before, when we were talking about what is your deep why do you want to do this? Having that why can make a difference when you then want to make that change. And knowing that, when you do make that change, it's going to be hard. It's hard for everybody to make a change. So, being brave enough to take that first step is a really big deal. Don't sort of, underestimate that or sort of push it down. Really believe in yourself, or try to get somebody or a little team around you that can, give you some support. So, maybe you grab a friend and say, hey, let's try this class together. Or, I want to catch up and and start, moving more. So rather than us going out for dinner, why don't we go for a walk? So find a friend, a loved one, get them in your corner, or get a trainer or somebody that you can work with. So they know that, you have to rock up to your session, and they're going to ask how you're feeling and, really try to support you in your journey. So mindset is a big thing. And I think if we can work on that, you'll actually see the results of everything else sort of flow through a lot quicker too.
I want to give more advice for those listening. So if somebody is hearing this and they're ready to start their journey for better health and they know everything they need to do, but the mindset is the part that's kind of stopping them because they know everything, but they're not doing it. What can they do to get over that little hump where the action starts?
Well, Mel Robbins has a really good strategy. She calls it the 3-second rule, which you may have heard of. So she says, give yourself 3 seconds. So maybe you're lying in bed and you're like, I don't want to get up this morning and put my gym clothes on. She says you give yourself 3 seconds. And once you hit 3, that's it. You just get up and you do it, no matter what it may be. So sometimes, you could use the 3-second rule. I think, generally when it comes back to that mindset, having that strong why, knowing that it's going to be hard, but being brave enough to step through, and then creating consistency so it becomes a habit is a really big thing. So, you get up, use the 3-second rule on the first morning to follow through and do it. And then that night, maybe you put your gym clothes out, ready to go for the next morning. So again, there's no hurdle to try to get over. So try to make it as simple as it can be for you to follow through. Maybe, you're like, I don't want to have to drive to a gym. Well, that's great. Leave your clothes out, roll out of bed, put the clothes on, and then go do a home workout. So then you don't even have to leave the house. So really try to eliminate any of the obstacles in your way that may stop you, and then try to habit stack. So that means layer it on to a habit that you're already doing. So then it just becomes second nature to do it. So one of my clients, we were talking about this the other day, and she said, so you mean like, when I get up and, I wash my face, I put my moisturizer on and I do my skincare routine? Because I've been doing that since I was 20, and I'm now 45. I'm like, exactly. You've been doing it 25 years and now it's so automatic. You don't have to think about it. So really adding in that new, aspect of health by just layering it on to a healthy habit that you're already doing.
So, so good. And that's honestly what I have to do, or not what I have to do. That's what I do even now, to, habit stack myself. And because I know myself, and if I don't make it easy, the new habit that I'm trying to form, or the new thing, the new healthy activity that I want to do, if I don't set myself up to do it, then I won't do it if I don't make it easy for myself.
That's it. If you sort of say, oh, I'm going to go to the gym 5 days a week after work, and you're really tired after work and the traffic is crap and you don't really like working out in front of other people, you're probably not going to follow through and do it. So it's really trying to build in this healthy habit in the simplest of ways, because we're all super busy, and if it's something that you're already a little bit resistant towards, you'll probably find another excuse to avoid it. So, getting rid of those barriers, find that sort of point of least resistance, and then follow through and make a commitment. Whether or not you write it in your diary every day like an appointment, every day at 7 a.m., I'm doing a 20-minute workout, and it's in there like, you're meeting a friend. You wouldn't stand them up. So don't stand yourself up and follow through. And once you make that commitment, and then the consistency starts to follow through, then that's those 1% changes over time that are going to give you those really big results.
Mm-hmm. Yes, something that I do personally, when I get home, there's a couple days a week that I work remote, and when I get home, I want to take a walk. But I notice after the first couple days, once I walk in the door, I don't want to go take the walk anymore. I just want to be horizontal. So I put my headphones in my car so that when I pull in the driveway, I just park and I walk before I even am allowing myself to go inside.
I actually give that advice to a client the other day, that she works long hours, has to drive quite a way to work. And she was saying that, when she gets home at night, she likes to read, but she's just so tired. So what she started doing is listening to an audiobook in the car. So then she's driving and listening to the audiobook. And then she said she's just, once she goes in the door, same as you said, she does not want to exercise. She just wants to sit down and relax. So as soon as she gets home, parks the car, she gets out and goes for a walk around the lake before going in the house.
Yes, yes. It's all about setting it up beforehand and learning, your own habits.
That's it. And, sometimes it's a little bit hard to set those habits up, but once you do, the follow through becomes so much easier.
Hmm. Are there any particular movement or health trends that you're excited about or you think are particularly beneficial for people today?
I think just in general, people's awareness around holistic health has really, sort of started to increase. Previously, most people just sort of focused on exercise and nutrition, which is great. But now people are starting to think about their gut health and in things like inflammation, and our nervous system and stress. So I think it's fantastic that these things are coming in and technology is helping in the sense that we know that sunlight in the morning, exposure to sunlight helps to reset our circadian rhythm, which means we're then going to sleep better in the evening. But we don't always have access to sun in the morning. And you might not have the time, when it's not sunny outside, you need a good 20 minutes of sun exposure. So now you can get things like light boxes that can help you get that. So I think there's some exciting developments in products that can help with your health, especially if you're time poor or, living in sort of the wrong area of the world to get what you need. So those sorts of things I'm really excited about. And then just in general, the quality of the health information now that's coming out and that's accessible to people. Previously to find out about, gut health and stuff was super hard. But now, whether or not you're jumping on and following, famous authors on social media or listening to a podcast, it's totally free with an expert. I think that is really exciting that people now have such great access to amazing information.
Absolutely. There's endless information. I mean, I feel like there's almost too much information because now it's people have the problem of what information to believe.
Yeah, so then we've got that too. And I always say to, because my clients always ask, a client came in the other day and she said, I've seen this product, it's called bee venom and it's meant to be great for arthritis. And she's like, so, should I get it? And I said, well, I've done, research on it. I said, there isn't a lot of studies out there yet to show the benefits of bee venom. And there are some studies, because people don't even realize they may have an allergy to bees, it can be, a potential allergen. So you do really need to be careful. So I always say to my clients, do the research, if possible, speak to a professional, look up somebody's credentials. So, if you are watching, let's say, social media and there's somebody on there talking about, bee venom, and it's just a random person, but they're not a doctor, and they don't have any experience, they're not referencing any studies, then that's when you need to do your own research. So like anything, check out people's credentials and do your own background checks. And I think that always serves people well.
Oh my goodness, Kate, I am going to use this as an opportunity to share something that I don't think I've ever said on this podcast. And that is with the bee allergy. So my only allergy ever was pollen, like outdoor environmental pollen. And I did not know that if you're allergic to that pollen, that you shouldn't consume bee pollen. Bee pollen is presented as a health food. It's in a lot of organic smoothie places. They put it in smoothie bowls and all kinds of things. And I had it every day for a week. And that's kind of when I started getting a lot of health issues. So just a little, you just reminded me of that. It was years ago. But if you do have any type of allergy to pollen or bees, and bee pollen is on the menu somewhere, that's definitely something that you want to avoid or proceed with caution.
Yeah, and you bring up such a good point because most people will be like, well, I've never been stung by a bee, or maybe I had an allergic reaction, but why would the pollen or the venom make a difference? It's not the bee itself. So that's where, these type of products, like you do need to be really careful with, and you do need to do your research on. And if like my client was kind of unsure, she came to me and asked because she knows that, I've got qualifications and I've got access to, journal articles and studies, that if I don't know, I'm going to give her, I'm going to do the research and then I'm going to come back to her and let her know with, an educated answer rather than a guess. So, I'm sure lots of people get caught out in those types of things. And that is sort of one of the downfalls of having so much information, that you do have to wade through it sometimes to find out what is the good information.
Right. And sometimes it is only finding out the quote unquote hard way by actually trying something and see how you respond to it.
Yes, and let's hope that, it's keeping it safe, isn't it? So if you have a bee allergy, you wouldn't go to try bee pollen. But if it's just something like, well, I've got back pain and maybe I'll try Pilates, again, rather than going to a group sort of fitness class where there's 15 or 20 people, go to a studio where you're going to get one-on-one or more closer attention. Or if you are going to do one of those bigger classes where there's lots of people and there's not as much attention, being really aware about your own body, making sure you stop if you feel pain or it feels too hard. And that's where I think sometimes we get a little bit scared and we're like, oh no, we can't because, everybody else is doing it. We have to keep up or we have to do the same thing. And we really need to listen to our body and sometimes have to say no, even if that means we're going to be different or, we have to stand up and it feels a bit uncomfortable.
I have one more question for you, but before I ask it, is there anything that we didn't cover today that you want to share?
Not really. I think when it comes to health, that just starting with one thing at a time, I think sometimes we go, oh yeah, it's the start of a new year. We're going to do everything. We're going to start exercising and eat healthy and change our sleep routine. And it all becomes a little bit too overwhelming. So if anything, it's just to let people know that starting with one thing at a time, just going slowly with that, make that become a habit first, give it a couple of weeks. And then once that becomes a habit, then look at either starting something else or taking something out. A lot of people forget that we can take out things and that can actually, make us healthier or ease the burden rather than thinking we have to add things in all the time.
Oh, that is such a good point. Yes. Because a lot of times we are overstimulated or like we're eating too many things versus not getting enough of different nutrients. Sometimes it's too much of variety, or sometimes it's too much screen time or too much water, even just whatever it is.
That's it. So, sometimes less is more. And whether or not, we're talking screen time, maybe tonight you can turn off the TV or, turn off the computer half an hour before, you usually do. Say you do it at 8 o'clock, we'll do it at 7:30 tonight. And then see if that makes a difference, with your sleep. So we know exposure to blue light, stimulates our cortisol production and our stress hormones. And that is going to affect our melatonin production that helps us fall asleep. So if we can downregulate that, dim the lights, either read a book, talk to your partner, maybe have a bath or a shower, something else, half an hour before you go to bed so you're not on screens, and then see what your sleep is like, you might notice a difference.
Okay, my last question for you is, what is your number one health tip? Whether it's mindset, diet and nutrition, physical, emotional, just the one piece of advice you would like everyone to know.
I think overall, it's keeping it simple. So as we were sort of saying before, don't do things that feel that it's going to be too hard or too complicated that you're not going to really try to follow through on. If you want to start, maybe you're not, haven't got a regular exercise routine and you need to move more. Start with 5 or 10 minutes and just do a walk or do the easiest thing. If walking is too hard, sit on a chair and do some upper body stretches, do something that's going to feel like the least sort of barrier of resistance to start with, and then just build on it slowly from there.
Very well said. Couldn't agree more. Thank you so much for your time, Kate. I appreciate everything that you shared.
Thanks so much for having me on today, Jessica. It's been a pleasure.